Welcome to the Coach's Table Podcast, where coaches come to grow personally and professionally through real-world application and online education. Hey guys, what is going on today? Wow, it is a beautiful day outside. It actually feels like spring. The sun is shining. It is gorgeous. It's a beautiful day. Before we get started in today's episode, let's get the administrative stuff out of the way. For those of you that don't know, we are on YouTube as well as Spotify and Apple. So if you're watching on YouTube, do us a huge favor. Drop us a comment, drop us a like, drop us a subscribe. Would absolutely appreciate that. That's the only way that we continue to grow in YouTube and in Spotify. So if you're listening on Spotify, Apple, or whatever platform you choose, do us a huge favor, subscribe, like, and leave us a review. I think it takes like 5 seconds for you to do that. Would really greatly appreciate that so we can keep having great guests on like the one we have today. So, Mr. Dan Rosen, what's up, my man?
How we doing, Ricky?
Gosh.
What's going on, man? How you been?
I'm good. How about you, man?
Doing well. Can't complain about the warm weather in February in South Florida.
Yeah, so for those of you that don't know Dan works at Cressy Sports Performance down in Florida right now. I'm sure you can tell your own story, but prior to he interned with them. Dan and I interned at Elon together, and that's how we met. And we've just stayed connected ever since. And now he's doing big things at Cressy Sports Performance. So if you want to, man, tell him kind of like where you've been. You were at Merrimack, and then, kind of what's your journey been?
Yeah, so went to school at University of Maryland. That's kind of where it all started. I wasn't sure what I wanted to do as far as a career. I grew up playing baseball. I was in the physical therapy office, so I was always like, oh, I'm going to be a physical therapist because my arm hurts and I know how to treat people's arms now. But I shadowed a physical therapist nearby for a while. Wasn't really my thing. Got into college, was like, oh, I'm going to be an orthopedic surgeon. Started shadowing orthopedic surgeons in the Virginia Beach area where I'm from, and I actually loved it. I love watching surgery. But honestly, like when I would go to sleep at night, the thing that would keep me up was strength and conditioning because I love training myself, and I've always been super active and just physically active. And so I got to college at University of Maryland, and I was set to intern for Will Franco, who's now the Boston College baseball strength and conditioning coach. But then COVID happened. In about a week's time, I was told to pack all my things and get off campus. So right the next semester, I was supposed to intern for him, and so obviously that didn't happen. I went home. Thankfully, the gym where I trained at in high school stayed open during COVID. Whether or not they were supposed to, I don't remember. But my high school strength coach was still there, and so I just asked him, I was like, hey, can I shadow you? Can I intern for you for the next few months while I figure out what I want to do after I graduate? So I ended up graduating University of Maryland online in December 2020, and I'd already been accepted to be an intern for Cressy Sports Performance in Massachusetts for January 2021. So I did that until the summer of 21. Then you and I interned at Elon in the summer of 21. Right after that, I did a graduate fellowship at Merrimack College under Coach Mike Kamal and Coach Mike Vaughn. So I did that for a year, got my master's degree. This past summer, I was on Cape Cod. I was a strength and conditioning coach for the Brewster Whitecaps in the Cape Cod Summer League. Mm-hmm. That was a lot of fun. And then I grew up a Red Sox fan, so this is where the story's going. And I was born in Boston, grew up a Red Sox fan, and every year in the Cape Cod League, the teams get to go on Fenway Park, the Red Sox stadium, and take batting practice. And I saw Eric Cressy there, who I had known previously from my internship in Massachusetts, and me and him just got to talking, and then lo and behold, either like that day, the next day, or a couple days later, he offered me officially to come work down here at Cressy Sports Performance. So wow. I like to tell people I got hired at Fenway Park, which is a pretty cool story. So that's where I'm at now. I'm in South Florida, Palm Beach, and just enjoying what I do. So
man, that's awesome. That's awesome. I think that's awesome. One of the things that you said, and you said you love watching surgery. What's funny to me is, well, I've had 3 knee surgeries. When I think it was my second one, maybe my first. No, one of the 2, I can't remember. But the doctors asked me, like, do you want to watch it? And I was like, absolutely not.
No, no,
Like,
yeah.
are you kidding me? Being awake, watching you shove these knives and stuff.
Mm-mm.
Like, yeah, it's orthoscopic surgery, so not really like knives, but like watching you shove these things inside my knee, like that's a
Yeah.
visual that I could never unsee. And I was like, absolutely not. There's no
You
chance
know
I'm
what's
doing that.
crazy is I've seen a full hip replacement. That was probably the biggest surgery I ever saw, and it's barbaric, man. The doc is just slamming things together, trying to chip the head of the femur off. It's crazy,
No
and
way.
I can watch that from a foot away, no problem, be
Mm,
totally fine. If I see someone try and put like if I go get a shot or something,
yep.
right?
Yep.
I cannot watch them do it. I can't see
Hmm.
anything with my own body, or else I'll
No.
just get nauseous. It's crazy.
Yeah.
I don't know why it is, but yeah, surgery was super cool to watch, and I think um, it gives you a bigger respect for human anatomy. Like I never
Oh.
respected human anatomy until I
Mm,
saw like what nerves look like, how fragile a nerve can be if the doctor makes a mistake, and what
mm,
like kind of recovery process that puts an athlete on or puts an individual on. But also kind of like how resilient the human body is in a
sure.
sense. Like
Yeah.
coming back from a full hip replacement, seeing what the doc did, and then also seeing that same patient walk away like a few hours later.
And
It's
feel good
kind of
about
nuts.
it. Yeah.
Yeah, feel
Yeah.
better than when they came. It's weird. I don't understand it, but it's not my job to understand that kind of thing anymore. So we're
That's
good.
pretty crazy. Yeah, that's why I don't give blood because I'm
Mm,
deathly afraid of needles.
yeah.
So like yeah, seriously. And when I was having my first surgery, I do remember this. This was my first one. They had to like put an IV in my hand right here, you know.
Hmm.
And it was actually funny because I was like fighting with the nurse. I was like, "No, you don't have to do that." And she's like, "We have to do that." I was like, "No, no, no, no,
Yeah.
no, no." I was like, "You don't have to do that. I'm gonna be perfectly okay." She's like, "It's our protocol." I was like, "I don't care."
Yeah.
Obviously, I lost that battle, but
Yeah.
no,
Yeah.
seriously, I hate needles so
Yeah.
much. But
Yeah.
so, man, that's crazy. So, tell us what it's like day to day to a private sector strength and conditioning coach. What does each day look like? Are you being burnt on both ends of the candle? And what I mean by that is super early morning training sessions before people go to work, and then late in the afternoon when people get back, or what does that look like for you guys?
On that side of the question, all I have to say is thank you, Merrimack College, because I was up at 4:30
Yeah,
sometimes. Now most times like 4:30 5 a.m. every day, and then I
yeah,
wouldn't be walking back into my room until 7 p.m. that night. So
yeah.
I got accustomed to the long days, and I enjoyed every minute of that. If I didn't
Mm,
enjoy those 12 plus hour days,
yeah.
I would have been burnt out a long time ago. I would have quit this industry a long time ago. I think that year at Merrimack kind of taught me that this is what I love to do, and that
Mm,
burnout certainly still a real thing, but that I can
sure.
handle those long days. So, and
Yeah.
the days here are certainly not as long. There's some days like we're training the Palm Beach Gardens Fire Department in the mornings right now,
That's cool.
and yep, it is really cool. They get there at like 7,
Sure.
and then on those nights I won't get home until like 6. So like it's still a long day.
Yeah.
But what's nice about the private sector is that you always have a constant influx of athletes. We have them scheduled times where they can come in. So I know from 8:30 in the morning till about 1 in the afternoon. That's my pro sector. Like I know a bunch of the pro guys are gonna come in, minor leaguers, professional league, or major league, independent ball guys. That's the population I'm gonna be working with, and then trickling in around 1 and throughout the rest of the day till 5, 6, whenever I get off is gonna be your
Sure.
high schoolers, your college guys, your general pop, and
Hmm.
no, it's good. I don't find like that I get burnt out at all just because it's
Yeah.
I'm constantly interacting with people and I love talking to people. So
Yeah. Yeah, that's awesome. And yeah, I mean the college world will do that to you, right? Though,
yeah, yeah,
which it's not a bad thing.
yeah.
It's really not. I mean, it's not as terrible as what it sounds. Once you get kind of in a rhythm and get going, like you're just like, okay, cool, Groundhog Day, again, right?
Yeah, yeah.
So, actually, I'm interested, and I've heard more about PRI. I'm not very educated on it.
Hmm.
I know you are more educated on it than myself, and I know especially in the baseball world, a lot of baseball strength coaches, utilize PRI. Big believer in it.
Hmm.
Some will actually like really classify athletes based off of that, based off of their rib cage width, and I don't even know if that's a part of PRI. But
Yeah, yeah, it
talk to,
is. Yep,
talk to me
yep.
about that. Like I'm serious. Like I don't know anything about it.
Yeah, and neither do I. So, yeah, according to everybody who's smarter than me at Cressy,
Sure.
which everybody is,
Yeah.
I don't know anything,
Okay.
honestly. But no, the best way I can explain it, PRI stands for Postural Restoration Institute.
Mm-hmm.
And essentially what it, like how I view it is that the structure of the body, so like the skeletal frame,
Mm-hmm.
is kind of more of a driving factor in terms of exercise prescription than muscles or movements for that matter.
Sure.
So like you were just talking about, for instance, the width of the rib cage. So
Yep.
we like to look at something called the infrasternal angle. So if like
Mm-hmm.
you were to take your thumbs, and I'll point my camera down a little bit.
Sure.
If you were to take your thumbs, and this is just like a general kind of assessment that we do,
Yeah.
and
Yeah.
you
Yeah.
place them, the tips of your thumbs right underneath the sternum, and then
Mm-hmm.
really dig into someone's rib cage, you can see what degree their infrasternal, right, the infrasternal angle is of their floating ribs,
Sure.
and what essentially that tells you is just what they're biased towards, right? So, for instance, like wider infrasternal angle guys, they're more of your muscular based athletes. They're more of your force based, not as good as at rotating, and this is for a variety of reasons, including like where they get air in their body, the relationship between their pelvis and their rib cage, the shape of their body, the way the guts interact with the pelvic floor, all this crazy stuff, right? And then a narrow infrasternal angle is a guy who's like a little more elastic, a little bit better at rotating.
Mm-hmm.
And essentially, what I've come to find out, or like come to believe with PRI, is that we're all asymmetrical. We have a heart on the left side of our body, we have organs on the other side of our body. If you look in the mirror, you're, like good chance that your left rib cage is flared up to create space for your heart, and then the right side of the rib cage is down. And just like, and then the back of your body will mirror kind of the front of your body. It's weird. I'm trying to find the easiest way to explain this, and it's like the cliche saying of like if you can't simplify it, then you don't truly understand it.
Sure.
And I don't think I do to the point of where I can simplify it. I think there are people who do, obviously, that I work
Sure.
for.
Mm-hmm.
But the way I just view it is like every person's body, their skeletal structure is different,
Sure.
and I'm going to program based on that. And there's a bunch of different programming rules when it comes to PRI,
Really?
positions that mean different things, and so that's kind of where I'm at with it. And then one of the guys that I find a lot of inspiration from, two guys actually, I find three guys I find a lot of inspiration from in terms of like understanding this model is Bill Hartman. He's at IFAS. He's a physical therapist at IFAS, private training facility in Indianapolis. He created the compression expansion model, which really takes the PRI model apart and kind of sorts it out and makes it his own. And then the other two guys, Andrew Lissy and Shane Rye, are coaches here at Cressy Sports Performance, and they've just kind of deep dove into that system and made it more digestible for me in terms of how to program for guys.
Sure.
Whatnot. Yeah.
So
I don't know if I answered your question there at all.
Yeah. No, you did.
It's a very confusing way about looking about the body, and I think why it's not as big as I think it should be is because it is so complicated, and I think they make it more complicated than it has to be sometimes.
Really?
I think if it was able to be more digested and more individualized in larger group settings, so like when you're in the college setting, you're working with 30 athletes at a time.
Yeah.
Very hard to create a PRI modeled program because it's so based off of everyone's individual posture. But I do still think there are like laws and ways to go about using PRI methods in a group setting.
Sure.
Luckily, here at Cressy, every individual gets their own program, so we can take all of the PRI nuances and program them specifically.
So I guess that was my next question, right? And this is a very general question, but should we base training off of PRI? Like, should we base it off of the skeletal anatomy of an individual? Or should it just be another tool in the tool shed that, we can pull out and utilize and say, hey, oh, that makes sense. Let me kind of confirm it with this other potential bias or this potential way of thinking. Oh, you can't rotate. Oh, or not that you can't, but you're, limited or whatever the case may be. Oh, that makes sense. Like you have a really wide rib cage, or like, how does that really come into play from a programming standpoint?
Yeah, I think it can be both. Because I've seen it be both. So, for
Sure.
instance, like, I've seen coaches who are very educated with PRI, and what
Mm-hmm.
they'll do is they'll just create an extended warm up, make sure that the athlete's rib cage and pelvis are stacked essentially, to give them more movement options, to make sure that they're not compensating and whatnot, and then they're going to go do your typical strength and conditioning program where they're going to load the athlete up, they're going to drive power, they're going to drive strength, drive hypertrophy, whatever the athlete needs in that sense, right?
Mm-hmm. Mm-hmm.
But they start with the PRI, breathing, warm up, make sure that the athlete gets rid of compensation, gives them more range of motion, and so on and so forth,
Yeah.
right? But then I've also seen it taken into the lifting itself, where you can implement posture based on how you load an individual. So, for instance, like if I do an ipsilateral load, I'm going to bias more external rotation on that lead leg. Say we're doing like a split squat, right?
Mm-hmm.
If I hold the dumbbell in my right hand and my right foot is forward, right, I'm
Mm-hmm.
going to bias external rotation on that front leg. Whereas if I was holding it in a contralateral load, so in that left hand with the right leg forward, I would be biasing internal rotation in that front leg,
Sure.
right? So there's all these, like I said, there's all these little nuanced concepts
Mm-hmm.
that you can load an athlete and drive the programming around these PRI concepts if you know what you're doing, like if
Sure.
you know what the athlete needs or lacks.
Mm-hmm.
But then I've also, like I was talking about how it's kind of hard to implement in group settings. Rick Franz-Blah at University of Clemson,
Yeah. Yeah.
director of
Yep.
he's
Yep.
super big into this.
Yeah.
Super.
Huge into
I
it.
was fortunate enough to listen to a seminar he gave not too long ago where he basically buckets athletes based on the shape. Like,
Yep.
are
Yep.
they wide hips and a narrow torso? Are they a wide torso with narrow hips? Are they a wide infrasternal angle? Are they a narrow infrasternal angle? And then he buckets these guys based on that. He's not
Yeah.
able to give each guy their own program, I don't think.
Sure.
But he buckets based on that, and he has rules that he'll give narrows, wides, and then he also videos his guys to see like what kind of compensations or
Yep.
movement strategies they go into, and then he'll program based off of those. So you can get as creative as you want with these PRI concepts and the
Mm-hmm.
compression expansion model.
Mm-hmm.
I think you're limited to your understanding, and right now my understanding is such that I'm good with the basic rules.
Sure.
I don't think I'm at the point yet where I can say, "Oh, this is Kendrick's table test. I know everything about this athlete," because there are guys like that. They can just
Yeah.
say he has this compensation, he moves like this, he had
Mm-hmm.
this injury, so I know he's going to do this and such. And I'm not there yet, so I kind of try and create a stack between the pelvic and the rib cage in the warm up,
Yeah.
and then let's load them based on what they need: power, strength, hypertrophy. And then if I know they need like external rotation, or they're limited in a shoulder flexion, or they're limited in this, I can program around that.
Mm-hmm.
But I'm not as good as obviously I'd like to be.
Yeah. Absolutely. Yeah. It's really interesting. Especially, I have a friend that we went to graduate school together at Louisville, and she is now a GA at Clemson. She's finishing
Mm-hmm.
her second year, and she's worked with baseball the entire time though. So it's really interesting to talk to her and kind of hear what they're doing, or at least conceptually speaking. And they have a machine. Gosh, I can't remember the name of it. What is it? It's like I'm gonna jack it up. It's like a Protos. That sounds wrong.
Proteus.
Proteus. There it is.
Proteus motion. Yeah, we have one here at Cressy.
Yeah, talk to me about that. That's really interesting.
Yeah.
I've only seen it, from social media. I've never done anything with it in person.
Yeah.
Talk to me about that. What do you guys do with it? What does it do? What does that kind of look like?
Well, so, and I might botch this as well. It's like a 3D resistance. So like depending on where you move, it has like a reciprocal. It's not like a cable where the opposition is coming from one spot, or a band, or a barbell, right? It's going to mirror how you move. And we use it a lot for rehab. Like if a guy can't load his like whatever, right?
Sure.
You can adjust the loading on the screen and whatnot, and program based on what the athlete needs. But what we'll do is when an athlete comes in, specifically our pro guys, is we'll take them through the Cressy Sports Performance Test. We actually have a test that, or I think it's on every Proteus motion, and essentially it's a bunch of different smaller tests within the bigger test. And what we're looking for is like trunk rotation power, anti-trunk rotation power, like counter movement versus non-counter movement, leg strength through like vertical jump tests, Haydn, so like lateral bounds, We'll do shot puts, rotational shot puts. We'll do something that's called DN2 PNF, which is just like a diagonal chop with one arm to test their arm strength. So there's a lot you can get. It again, it's like limited to your creativity, but we'll typically do a lot of rotational power things on it, and that's kind of what we train it for. Just like a med ball, we train it for rotational power and more speed emphasis than anything, because you can only load it up so much.
Sure. Yeah, you could probably load it more than like the weighted balls that you guys have, to throw either backwards or forwards or whatever the case may be.
Yeah, for sure.
So, and you can probably provide resistance at different angles, right, of that throwing motion or the hitting motion, right?
Yeah, and it's really cool. You can also see like how much force someone is, like if we do a test, right? If I do a shot put and I'm starting here and then I'm pushing the Proteus handle across my body as I rotate, you can see how much force is being produced at each length of that shot put. Like, so are you producing more force right at the beginning, in the middle, at the end? It can tell you after you do the test, like how you bias force production. So there's acceleration and there's power. Both are like testing whether or not a guy is more elastic based or if he's more muscle based. And that can all tie into the infrasternal angle, like I was talking about. So like we complement our PRI testing with our actual programming. And it's just another eval tool that we use to see what an athlete needs and what they're lacking.
Okay, so taking that one step further. So you run tests on guys, a multitude of them, and how do you then implement that information to design a program? Because this is, I'm going to say like next level stuff is probably very specific for baseball athletes, right? Like, I don't really see any other athletes doing this. One of the things that I saw was, do you know what OxFit is? Are you familiar with that?
Not familiar.
It's just essentially, how do I explain this? It's a rack, and every thing on it is like a force deck. So like the base of the rack is a force deck. And you can do, all your various movements on it and stuff. It's interesting. I don't know. It's interesting. I'm just gonna, if you want to research it more, go do that. It's interesting. I'm just gonna say it's interesting. I think it's unique. I think it's cool, but it's just very interesting. But anyways, how are you guys taking that information? Because I think one of the things that we do really well is we collect a lot of information. But if we're collecting information for the sake of collecting information, are we wasting time? Because if we're doing nothing with that, and if it's not causing us to make decisions, then what are we doing with it? So I guess the question is, with the information you're collecting, how do you then take that basic program off of it, and then how do you run that and say, what's your pre-test, post-test look like? Like, how does that process kind of work?
Yeah, so with those pro guys, we when they come in for their original eval, when they get back from the season, we take them through a test. And then I wish I had it gives you a screen with all the results and the interpretation of the results. I wish I could show you. Obviously, I can't. People can go on the Proteus Motion website and it's all there. But essentially, it will tell you, like I said, things they're weak at. So whether that's like for the lower body, it could be like horizontal force production or vertical force production. So we have like the lateral bound and we have the vertical jump. It'll tell you whether or not they are more biased towards like a elastic movement profile or a muscle-based movement profile. And then we have one for the core, so we'll do a lot of chops and whatnot for that, and it'll read out the same thing. Like, are you better at a counter move, like a plyo core rotation, like a counter movement plyo rotation, or are you better from a dead stop and just trunk rotation? It'll tell you asymmetries left to right side, which is helpful to know. And then for like the upper body, like the arm strength and all that good stuff. And it all gives us asymmetries, which like same thing with like a force plate, like you were talking about the force decks. Like if something's 15% or more, like we gotta work on that. If a guy is super elastic but isn't really muscle based, or if he's too muscle based and isn't so elastic, then we can program based off of that. If one, like say for a righty pitcher, right, they're always driving off their right leg, right? But we know, so like here, I'll bring PRI back into this. If someone's stuck into their right side, right? If I'm stuck in my right side, I can't get any more into my right side. Does that make sense?
Yeah,
Like if
because
I'm
that's your physiological limitations.
right, like so, like if I'm sitting in this chair, right,
Right.
I can't sit even more into this chair, right?
Sure.
I can't get to the chair because I'm already in the chair. Does that make sense?
Yeah, yeah,
So
yeah,
if
yeah.
I'm already in my right side as a right-handed pitcher because they're
Mm-hmm.
always loading into the right side, or a right-handed hitter, whatever,
Yep.
right? If I can't load into my right side because I'm already there, chances are I won't be able to propel myself out of the right side,
Makes
right?
sense.
We
Okay.
know as a strength and conditioning coach, eccentric is like where the major force production is, and then you concentric based on what you can absorb, right?
Sure.
If I can't absorb anything because I'm already in that side, then I can't produce anything, right? So like if I see on the Proteus that the guy has a super big asymmetry on from his left to right lateral bound, his height, right?
Mm-hmm.
I'll know that maybe if his right side's a lot weaker, this guy is super stuck in his right side, which is common after a season. And so we need to do a lot of things in the gym, PRI based, to get him into his left side. So that might be breathing drills, that might be lateral sled drags to the left side only. That might be setting his feet up in a position on pretty much every exercise he does that will bias his weight shifted to the left. And we just do a lot of unilateral, like asymmetrical programming. And the Proteus can help us make that decision as to how this guy produces force and how he moves.
Sure.
And so I think it's valuable for that. What I will say, disclaimer, I love the Proteus. I think it has its advantages. I think a disadvantage is that it doesn't dictate whether or not you're going to be successful at your sport. A lot of guys and coaches might get so caught up in the results that they miss the bigger picture of that. Like a pitcher still has to know how to pitch. A hitter still has to how to hit. The best guy in the weight room, as you know, does not equal success on the field of play, right?
Yeah.
I'm not going to say who it was. One of the best pitchers I've seen this offseason probably had the worst, if not one of the worst, Proteus tests, and he's still going to be like a big leaguer.
Yeah.
Right? So it's not a 1-to-1 correlation, but again, what it can tell us is what that athlete was lacking. And if we can fix or help what that guy was lacking, then maybe he's going to become an even better pitcher.
Yeah.
Right?
Well, yeah, 100%. And, that's not just for pitching, but that's for, all sports, right? And I guess it bears the question, which is a constant up and down battle or seesaw battle, whatever you want to call it, is, at what point do you correct it, or at what point do you just say, hey, he is where he is. Mm-hmm. He's, a multi-million-dollar athlete, $100 million athlete, whatever the case may be. Like, am I going to make things worse if I attempt to potentially correct him the other way? Or, because like athletes are the greatest, like the best athletes are the best compensators. They're the 100%. Best. Like, regardless, it doesn't matter. You can be the best weight room guy, and that's great. But if you're not good at your skill, it doesn't matter. And if you are good at your skill, you probably have some things that are wrong. If we look at you from the standard strength and conditioning test, if we look at you for some reason, I was talking FMS with this guy today, and I was just like, yeah, okay. But like, you're going to fail in a lot of that stuff because the best athletes are the best compensators, and you can look at Fergus Conley's four coactive model on that, right? And that's really interesting and huge proponent of that. Like, I absolutely love that. But yeah, I mean, I don't know.
I'll give you a few analogies that have always helped me with the PRI stuff. So PRI and a lot of the PRI followers will say like the best posture is one that can change. And I fully believe that. Like, I don't think there's an ideal posture where like this guy has to be stacked this way. He just needs to be able to function in as many different postures as possible. Right. So by allowing an athlete, like I agree with you 100%. The best athletes are the best compensators. Yeah. But if we can give that athlete more room to compensate, if that makes sense, like more of a safe space.
Yeah, more bandwidth to compensate.
More bandwidth, right, exactly. That they're not always knocking into end ranges, and that like a compensation might be of a lesser magnitude if we didn't intervene with them than if we if that makes sense. Yeah. And then another way I like to think about it is like if I have two roads, right? If one gets traveled a bunch, eventually that road, like two dirt roads. If I travel one dirt road a lot, it's gonna get worn out and I eventually won't be able to travel that road anymore. Then I'm going to start taking the other road and I'm going to travel down that road a bunch of times. And eventually that road is going to get worn out and I'm going to have no roads to go down.
Mm.
Right. So I think by intervening with these guys, kind of what I'm getting to the point there is giving them as many roads to compensate towards.
Sure.
Right. That way they're never using the same movement pattern, the same degree of freedom on a joint in order to produce the same movement. So giving them as much range of motion, getting them away from the compensations in the off season. That way, when they inevitably go do their compensations in season, right? Because everybody's going to revert back to what their body instinctively wants to do. Right. Just making sure that they have the safe space to compensate more, I guess, is kind of where my head goes with that, and what I've seen is like if we didn't do anything to intervene, they're going to compensate regardless, like we've established, right?
Of course,
but they're only going to be able to compensate for so long. That kind of that dirt road path analogy. Whereas if we intervene, give them more range of motion, give them exposure to different postures and being able to breathe and produce force in as many different postures, then those compensations, they're still going to happen, but they're going to be more manageable and more longevity is going to come about that way.
Yeah, absolutely. I think that's really interesting. Thinking of it from that perspective, and I'm a huge fan of trying to increase an athlete's bandwidth. People say don't train in extremes, always train it. Like we're so granular with that, and we're so either always train extremes or don't. But I think it's just the fluidity between them. I also am a huge believer of if you've never been there, and what I mean by that, if you've never been in a position movement wise, right? How do you expect yourself to be strong in that position? And I look at that, specifically with basketball athletes, like if they're coming down on a dunk or if they are going up for a dunk or a lot of times if they get crossed over, like the ability to like sink their hips or just like some of the extreme ranges of motion, whether that's a knees over toes thing, whether that's a rotational component, whatever the case may be. Like if you've never been there, if you've never been exposed to that, when you actually get there in a game, which is typically at a high speed, by the way, that's typically where you'll see an injury occur. And like, we don't want that, obviously. So I'm a huge proponent of kind of pushing the limits or at least getting them into these ranges of motion that, like full joint flexion, like complete joint flexion that's weighted or, really getting up on a big toe and like driving that knee out of it, like big time. Like there's just so many different things that we can do, for them that they've probably never done before. Whether that's basketball, whether that's baseball, whatever the case may be, or rotation of the hips. I think the more I study, the more I realize like the hips are the number one thing. And I don't know if we focus on the hips enough. I think in the baseball space, you guys do a lot. When I think we can learn a lot from you guys in the baseball space, especially like the separation between the head of the femur and the pelvis compared to the separation of the pelvis and the head of the femur, and like understanding that you can work both, but like the different ways that you can do that besides just your classic 90-90, which is still a good drill, don't get me wrong, but like there's still so much other stuff that we can do besides just 90-90.
Yeah, so like I'll take like a muscle based approach to this to like compare it to the scout tools. Like one of the things we learned at Elon, I remember that article specifically, like it was like hamstring training or some sort, and like you need to train the distal portion of the hamstring as much as you train the proximal. And I never thought of hamstring training that way. It's just like we're going to train the hamstrings. And now I always think about like we're going to train the proximal. We're going to train proximal and we're going to train distal and we're going to train collective. We're going to train hinge pattern. We're going to train a bridge pattern. We're going to train a bridge pattern in a bent knee. That way we get distal and like so many different ways. Same thing with the pelvis. You can get the pelvis orienting on the head of the femur, but you can also get the heads of the femur orienting inside the pelvis. And so there's pelvic training with that. There's also like just as much with the pelvis, the rib cage is super important as well. So like getting the rib cage to move on a static scap, whereas we could also do scap training, like moving your scaps on a static rib cage. So it's like it's all the same in a sense. Each has their place, each needs to be trained. And I just like honestly, until I started working like almost exclusively with baseball players, I couldn't tell you what my favorite body part was to train. Now it's the scaps. I love watching the scaps move on the ribcage. I don't know what it is, but
Mm.
I think that just because of our like baseball, the sport,
Sure.
the need to get overhead and trying to do that with as little compensation as possible,
Yeah.
the scap such a like being able to control your scap and have good rhythm on
Mm.
the ribcage is so important. And I think the same is true for the hips, like being able to get the femur and the head of the femur to rock inside the hips, but also making sure that the orientation of the pelvis, the hips, allows your femur head to do that, right? Like if your pelvis
Yeah.
is tipped forward, chances are you're going to create some compensations. Your
Right.
head of the femur might be running into the labrum or into the
Mm.
front of the pelvis. And then let's not, like, I mean, I hate to get too far down a rabbit hole, but then
No,
you have your
please do.
guts to worry about. Like, uh, Eric Huddleston, another guy from iFast.
Mm-hmm.
Now he's with the Pacers.
Mm-hmm.
Super big on like actually thinking about what the guts are doing inside the body. And if
Mm.
the pelvis is dumped forward, then the guts can't sit in the pelvic outlet, right? They
Okay.
can't. If a guy's jumping, the guts have to go up and down off that pelvic outlet. It's like a trampoline inside your system,
Sure.
right? If the pelvis is too far forward or too far back, those guts don't have anywhere to sink into. And so the athlete has to then compensate. They have to knock their knees together. They have to drive some type of like compensatory internal rotation in
Mm-hmm.
order to stop themselves from falling into the ground and exploding back up and exploding their guts back up, if that makes sense.
Yeah.
So like
Wow.
the orientation of the pelvis is so important, not only for like making sure a guy has been there before, making sure that he has good hip mobility. But like if we go internal, we think about PRI and we think about all that kind of other stuff, breathing, the guts.
Mm-hmm.
It's like a rabbit hole that takes forever to get down. And I'm still trying to get down it, but it's so cool to get that. Like there are guys who program based off of like what the guts are doing, not what the muscles are doing, not what the skeletal structure are doing, but how functional are the guts inside of your body. I don't know it enough to program like that, but I think
Sure.
it's fascinating that we're in a field where like people have been doing this for 20, 30 years
Mm.
who will admit they don't have all the answers because you're never
Of
going to have
course.
all the answers.
Of
Like
course.
the human body is so cool.
Mm.
Um,
Mm.
and it's like cool, but also like I hate it because I'm never gonna have all the answers, right? It's like
Yeah.
who would have thought to
Yeah.
program
Yeah.
like Eric Hudson's big on and I'm sorry I'm going all over the
No,
place
you're
because
good. You're good. You're good. You're totally
um,
good.
Eric Hudson had a podcast on the Upper Left Performance podcast one time, an episode, and he was talking about how he uses band assisted jumps to help all types of athletes. So like you think of like a volleyball player, female volleyball
Yeah. Yeah.
player,
Yeah.
super wide hips but a narrow torso, right?
Mm-hmm.
She has a lot of volume because her hips are wide in her lower half, but she has no volume in her upper half because her shoulders are narrow, right? You think of it like a traffic cone, right?
Sure.
A
Yeah.
lot
Yeah.
of volume. Like if everybody can get that picture, like a traffic cone. A lot of volume means no pressure. Simple physics, right? High volume, low pressure.
Sure.
Low volume, high pressure, right?
Mm.
Environments.
Mm.
She has a lot of pressure in her upper half because her torso is so narrow that it's essentially driving her guts down, right?
Okay.
Does
Mm-hmm.
that make sense?
Yep.
When she goes to do a counter movement jump, she has so much pressure in her upper half. She goes to do the counter movement, all of her guts fly down into that pelvic outlet where there's a lot of volume because her hips are so wide,
Yeah.
right?
Mm-hmm.
But in an area of high volume, there's low pressure. So she needs to create a really big compensatory internal rotation pattern to close off that pelvic outlet in order to create pressure to shoot the guts back up. Does that make sense?
Yes, it does.
Kind of. I'm
Yeah.
sorry
No,
if I'm losing.
I'm following. No, I'm following with you.
So he'll use a band assisted pogo jump
Yep.
in order to slow down the descent to give her time to create pressure without compensation. That way she can jump back up without knocking her knees and shooting the guts up in a compensatory way. Does that make sense?
Interesting. Yes.
And then
Interesting.
he used RG3 as the counter to that. Guy, super broad shoulders, a lot of
Mm-hmm.
volume in the upper half, not a
Mm-hmm.
lot of pressure. Super tight waist, so a lot of pressure, not a lot of volume, right?
Okay.
When he goes down to a counter movement, he's not able to descend very much because there's not a lot of volume. He doesn't have anywhere to go,
Sure.
right? And there's so much pressure. So he'll also use the band assisted jump in order to give him like more time to make the descent less intense in order to free up more space so that he doesn't have to jam his knees together and shoot his guts back up because it's happening so quickly for RG3 as opposed
Sure.
to the female volleyball player, that he's just giving them both a strategy to create force without compensation. If I'm understanding him right, Eric, if you ever listen to this, which I don't know if you ever will, I'm sorry if I muffed that up, honestly.
Yeah.
But that podcast is fascinating to me. That episode specifically.
The Upper Left podcast.
Upper Left podcast with Eric Huddleston. Yeah.
Okay, so I have a question on that. Actually, I have a lot of questions. Okay. Question 1.
Yeah.
No, I have a lot of questions on it because I'm learning things.
I'm sorry, I ramble because I'm fascinated by it.
No, well, I'm really fascinated too, and here's the reason why I ask. Because, okay, I'm a huge believer. Hip internal rotation is the most powerful, best thing. In all honesty, I'm a huge believer in it. I think it's, when you think about it, it actually makes so much sense. At first, when I was watching basketball, this was years ago. When I was in the private sector, actually, before I went and got my graduate degree and all that stuff. But I was watching guys play, and I was working for a guy, and I was over at his house, and we were watching basketball, and we were watching athletes shoot. And if you've ever watched a basketball athlete shoot, you'll see that their hips or their knees, come in, right? Some are really bad, some are not bad at all. And it was really funny because I remember him saying something to me, and he was just like, he's like, yeah, I know it looks ugly. Like, that's our strength and conditioning, mindset on it, our thought process on it. And he's like, but it works for them, so we just leave it alone. And at first, I kind of took that as makes sense, right? Kind of passes the common sense test, if you will. But then when I got educated and all this other stuff, I was like, no, they're doing that because it's really good for them. Right? They're generating more pop from the hip internal rotation aspect, more power, and that's a good thing. And then if you start watching Olympic weightlifters that, get to the basement in a squat or a snatch or a clean and jerk or whatever, and then how do they get out of it? Well, we see their knees knock and we think that's a bad thing. And I don't mean knock as in they literally touch each other. We just see them come in and then come back out, right? So what they're doing is they're going from internal rotation back to external rotation, or probably more of a neutral space, and then come back up.
Yeah.
And it's the more you look at that, the more you see it, the more you hip internal rotation is such a strong position. And then if you watch somebody sprint, look at Usain Bolt, when he is switching legs, his knee literally crosses the midline of his body, which what is happening there? He's getting hip internal rotation, right? Internal to that external aspect of it. So I'm a huge believer in hip internal rotation. Some people will always be, knees out when you squat. And it's just okay, well,
Yeah. Well, and I mean, there's a lot of guys who have different reasons as to why they don't change it. Bill Harmon will talk about the guts. Joel Smith, I saw that video where he was talking about Usain and internal rotation and the sprinting and all that. And I think what it comes down to is that, or the way I look at it, I guess, is external rotation is creating an environment for space to be found, creating an environment for range of motion, if that makes sense.
Yep.
You descend into a squat, you kind of see guys' knees drift out. That's them opening up their pelvis so that they can descend.
Sure.
The internal rotation aspect is them closing off their pelvis to stop the guts from descending, to produce force, to find pronation in their feet, to excel themselves back up. And so that's how I think of it. Sure. You have 3 levels of gait is what some of the PRI folk will talk about.
Sure.
You have early stance, which is heel contact, and when your weight is shifted back, that's kind of it's creating space, right? You have mid propulsion, which is internal rotation, which is pronation of the foot, which is force production, essentially getting the body ready to produce force. Okay, and then you have toe off, which is late stance, which is external rotation again, but it's a little different than the heel strike external rotation. Essentially, what it is, it's top speed, it's max propulsion, right? So in the squat, you go from probably early stance to mid stance and back to early stance, right? You need to go from external rotation, create space, descend down into your squat, produce force, come back up to neutral, to resting. Guys who are always on their toes, so basketball players, guys you've worked with before, they're always jumping, they're always coming off their toes, right? So they're always stuck in max propulsion, and so maybe a strategy we use is to shift them back a little bit into internal rotation to give them more access to internal rotation because they're always stuck in that late extra rotation, right? So
Sure.
I don't know why I just went on that tangent there, but I agree with what you said in that
Yeah.
I think it's wrong to coach someone out of like their knees coming into their midline, whether it's during like a cut or a squat or whatever, because that's just the athlete's expression of producing force.
Correct.
And why would you ever want to stop someone from producing force? Because we know from playing sports, those who produce force quickly, and those who can produce force quickly and repeatedly are going to win.
Yep.
Right?
Yep.
If some knee going to the midline is happening there, I'm cool with it as long as they can control the internal rotation and the forces that they're producing during that. So like you were talking about earlier, like we need to give guys exposure and gals exposure to different positions and different forces and different force vectors and whatnot. If you don't do that in the off season, when someone makes a cut on the soccer field on the first play and all they've been doing is linear sprints and back squats in the weight room, see you later, torn ACL, right? Like that could happen. But as long as they get the reps and they're producing force in different planes of motion, I think the knee together is completely safe as long, again, as it's in a controlled environment. And control can be different things. It can be in the weight room, but it can also be on the field of play, again, as long as they have had exposure to that time and time again.
Yeah, 100%. It just goes back to that. Like if they're not exposed to that, then when it happens in a fast environment, aka in competition practice, then that's when we see negative things happen, which we don't want, right?
Why did so many people in so many different sports get hurt right after COVID?
Yeah, exactly.
No facilities were open. Their training was probably lacking, and the ramp up process was way too quick for them all to get. And I bet you a lot of torn ACLs happened from that knee traveling to the midline or Achilles popped or whatever the injury was. I don't necessarily think it was because of whether they were jumping or cutting or whatever. Like people have been jumping and cutting for years and years.
Yep.
It's probably just because they had a lack of exposure to it.
Sure.
Leading up to that event.
Yeah, absolutely. And then my next question, and I'm just so intrigued by this, and I think the baseball world talks about this the most. Talk to me about the relationship between the rib cage and the pelvis. I think, I'm just really fascinated by it, and maybe it's because I'm like, is there something I'm missing? Is it because like whatever the case may be, but like, talk to me about, the pelvis rib cage relationship, what we're kind of looking for, maybe what we don't want to see, like how important is that?
I mean, it's vital. I think it's incredibly vital. With that said, is like you look at any sport and you're going to find extension. Like jumping is extending. A pitcher rearing back to throw is going to go into extension. But again, this is all us in the weight room in the off season, giving them the ability to control that extension compensation, right? That making sure that they're in a place where they have more range of motion, and how they get more range of motion is like proximal stability creates distal mobility. I believe in that. Some people debunk it or think it's not important. I think it's important. And by proximal stability, I mean the rib cage and the pelvis's relationship, as you just alluded to. So if people are watching us, and I'll try and explain it in case people aren't, like imagine I stack my hands on top of each other, right? If I open up my top hand and I tilt it back, right? If you can imagine that space that's open right now, that's the front of my rib cage and the front of my pelvis. That's not going to rotate on itself really well, right? I'm crunching at my low back, my ribs are flared up, my pelvis is dropped down to anterior tilt. How do you expect me to rotate on that? Whereas if I'm stacked, pelvis exactly on the rib cage, they're neutral, this rotates really, really well, right? Does that make sense? That's baseball in a nutshell, is how well can you rotate, and how well can you transmit forces into either ball release after front foot strike, or how well can you transmit forces from the front foot strike to the ball as it hits your bat, right? And in order to do that, you need to have incredible shoulder hip separation, in my opinion, right? Some guys are able to compensate around that. Like some guys are able to rotate like a fridge, is how we call it. So instead of doing this, they kind of just go like they just rotate as well. Some are really good at that, right? Some are really good at that, but I think most people, and that's most wide infrasternal angles, which is what you are. And
I'm a fridge for those that don't know.
And hey, fridges are really good at producing force and power.
Yeah.
And if a fridge can learn how, and this not an actual fridge, people, but
Yeah,
like
yeah, yeah,
a human being like Kendrick,
yeah.
can learn how to rotate really well and already be innately good at producing force,
Yeah.
that's a recipe for a really good baseball player, really good rotational athlete. With
Yeah.
that said, most guys will do the classic shoulder hip separation. The hips open up between the shoulders, try
Yeah.
and keep the shoulders closed as long as possible. You can only do that if you are, or can only do that if you can stack the rib cage on top of the pelvis, right?
Okay.
So
Yep.
we see like from like I'm not a pitching coach, so I apologize, CSP pitching staff, if you're listening and I muff this. But if like a guy lands front foot strike, right, his
Yep.
pelvis is level, but he's still tilting back as if
Yep.
like his right, if he's a right hand pitcher,
Mm-hmm.
if he is his left foot hits the ground
Mm-hmm.
and his right shoulder is still tilted down towards his right hip,
Yep.
that guy is going to rotate upward. Like he's not able to rotate in line with his hips, so he has
Sure.
to then get his
Go
left
down.
shoulder down in order to get a neutral rib cage on top of pelvis, and then he can complete his rotation.
Sure.
Milliseconds are vital for pitchers in order to
Right.
get the timing of the arm down.
Yep.
A pitcher might be able to get away with that mechanic, that movement pattern for a little while, but like in terms of longevity, if you're not able to establish a neutral pelvis and rib cage relationship on
Mm-hmm.
front foot strike and get that rotation going immediately,
Mm-hmm.
your arm is going to drag. That can cause a bunch of anterior shoulder problems, a bunch of elbow problems, a bunch of hip
Mm-hmm.
problems. Your mechanics can be out of whack. The spin of the pitch is going to be out of whack. So I
Yep.
think, just to simplify and get back to your original question,
Mm-hmm.
a rib cage that is on top of the pelvis, that sits on top of pelvis, is much more efficient at rotating than one that is flared or tilted in
Sure.
such a direction.
So, okay, so give us some practical stuff because, and it's not, and what I mean by that is what you're saying, it is extremely practical, but I think a lot of people, and myself included to a certain extent, is like, okay, let me do more T-spine work, right? And
Mm-hmm.
let me learn how to rotate the spine. Let me, and it's like, is that the answer? Or how do people, how can they, what are some things that they can do to learn how to separate the hip from the
Mm-hmm.
shoulder while
Yeah.
keeping the rib cage stacked? T-spine is a very popular thing. Everybody loves to do T-spine work, and I think it's extremely important because our spine is not fragile. Yep, our
Mm-hmm.
spine is not fragile, so that means you need to put it in these positions. But what are some things that they can do to get that separation while staying stacked if they're a rotational athlete?
Yeah, I think that's a great question. I mean, there's a lot of roads to go down here, and
Sure.
I think the first thing you got to do is establish a relationship with the rib cage and pelvis. So, like in the absence of shoulder and hip separation, like if we're on stage one of a program,
Yep.
I'm not. He's coming right back from the off season, and that's all he's been doing is shoulder hip separation for the past 6 months.
Mm-hmm.
Let's focus on just like stacking the rib cage and pelvis. So maybe I'll get him on his back in what we call like a hook lying position, and I'll tuck his heels up to his butt, his feet are on the ground, his knees are bent, and I'll just do like maybe like kettlebell pullovers with him, or a dead bug is a perfect example. Like just making sure that the back and his neck are flat on the ground the whole time in his most extended position with his hands completely out and his feet completely out. Does that make sense?
Yep.
First, I think you gotta make sure that there is some type of relationship, or the athlete knows that there's a relationship between the ribcage and pelvis before they even trying to think about rotating the hips before the shoulders or whatnot. Right?
Yeah, and I think even just like here, but I think even to this before that, I think a lot of people can't even anterior and posteriorly tilt their pelvis appropriately, right?
100%.
Like, so the dead bug is fantastic, but like if you can't even anteriorly or posteriorly tilt your pelvis, like, I'm in this dead bug position, well, that's great, but like now your ribs are flared. Hey, like, drive your belly button down, right? That's kind of a cue that everybody uses, and it's just like you can't even tilt your freaking pelvis, Yeah,
I think that for anybody who wants to give it a try, I think that like a dead bug, or like a supine like kettlebell pullover, where the kettlebell goes over your head and then comes back. If you can't do those without your low back flaring up off the ground or your neck coming up off the ground, and you can't get your hand and your opposite foot to the ground, it's like that's kind of where we need to worry about, like spend a little more time before we worry about hip shoulder separation,
Yeah.
right?
Yeah.
Because you have no relationship between your pelvis. Like I just talked about, like if you can't manage those positions, the dead bug or the pullover,
Yep.
then probably you're already extended. And so,
Yeah.
like we talked about, that extended rib cage, that flared up rib cage, is not going to rotate very well on an anterior pelvic tilt.
Sure.
It's not going to happen,
Yeah.
right? It can. You're going to compensate in order to rotate, right?
Yeah.
How long you can do that, I don't know. How well you're going to be able to do that, I don't know. But I'm more confident that someone who has a neutral pelvis and a neutral rib cage will be able to rotate more efficiently.
Yep.
And then once you do that, I think there's just like a bunch of anti-rotation chops on a cable you can do. Med ball work is always good. Like just going from slow to fast,
Yep.
strength to power. Same strength and conditioning principles we've been doing for years and years and years. Just now we're getting a little more specific to hip shoulder separation instead of leg strength or instead of upper body power. Like right,
Sure.
it's just like progressing exercises from the most constraints to the least amount of constraints, and then eventually the most specific exercise for someone who needs to work on hip shoulder separation in the baseball world. Go hit, go pitch.
Yep.
Let's look at your mechanics. Oh, you're doing this too early. Oh, you're doing that too late. Now we can change some of our weight room programming to help you like either delay your front side from opening up too fast, or your hips and shoulders are rotating at the same time, and maybe if we create some better hip shoulder separation through like a facing away cable chop, right?
Sure.
Where
Sure.
the shoulders open up but the hips stay facing out away from the cable.
Yep.
Maybe we'll see some results on the mound or on in the batter's box. But like it's simple thing, kind of just watching them play their sport and then programming based on that.
Yeah, absolutely. I think,
and simple to say, not simple to do. I didn't mean to say simple there.
Yeah. I just think, this is so important not only for baseball, but for a lot of sports. Like, for instance, like quarterbacks for football, right? Like huge rotational sports. Here's one that a lot of people don't. Tennis. Tennis rotates incredible. A lot, right? Basketball, when they throw a chest pass or a bounce pass, or like there's a lot of sports require rotation consistently, right? Now baseball, every sport does. Baseball just gets.
I think the only sport that or only thing I can think of where like you don't want to rotate or like you're trying to resist rotation is an offensive lineman, maybe a wrestler.
No, wrestlers rotate a lot.
They rotate a lot, but like you don't want someone to rotate you.
Yeah.
If that makes sense. What I'm trying to say, yeah. Like, but yeah, there's like few sports where like
swimming
rotation isn't significantly important.
Yeah.
Well, swimming is incredibly important with rotation. That's all swimming is just a subtle rotation on the water. That's how they move. Yeah.
So, this what we're kind of talking about here is it applies to literally every sport, but baseball gets the limelight because the two major things that you see is hitting and pitching, which how do you hit while you turn and rotate? How do you pitch while you turn and rotate? Right. But we have to recognize that a lot of other sports, have a ton of rotation. And even my favorite sport now, pickleball, has a ton of rotation.
You and everybody else in South Florida, geez.
Yeah.
I'm the only one I feel like in South Florida who's never picked up a pickleball racket. I gotta get on it.
I've never picked it up. My mom plays, but she loves it. She loves it. I've never played, but so the point that we're making though is there's a ton of other sports that rotate and that need to have this recognition of that. And baseball and tennis, I think, are extremely similar. Like think about it. If I'm serving a tennis ball with a racket, typically I'm using, my dominant hand, right? I don't know too many tennis players that will serve with their non-dominant hand, but maybe it happens. I don't know. But I'm coming up and back, and I'm serving that thing at 120 miles an hour. Like, the amount of sheer force that's being created is insane,
Right. I mean, for whatever reason, it's ironic that you mentioned tennis. Like, I've been getting super into tennis. I've been watching a bunch of stuff on Netflix with tennis. They fascinate me. Like, not only do they have to be great rotators, but their deceleration forces, their ability to change your direction, so agility in the presence of a stimulus. How they don't roll an ankle or tear an ACL on every single cut is amazing to me. Because I would immediately, but those are athletes. Like, not that baseball players aren't athletes, but those are incredible. Their aerobic system have to be second to none. And then like you were just talking about, like if we can like take it back to the rotational aspect,
Yeah.
they're rotating off the ground. Like when they serve,
Yep.
some guys they leave the ground for like a split second, but
Mm-hmm.
even just a split second, like you don't have a ground reference to rotate on.
Right.
Rotating when you have contact with the ground is a whole lot easier than when you're in air and you're spiking a ball like a volleyball player or
Yeah.
kind of serve. Yeah, and they're in that extended position, right? To get their arm overhead, they're gonna flare their rib cage a little bit. They're gonna dump their pelvis forward, and so I think again, bringing it back to this, like if you can teach them how to neutralize their pelvis and their rib cage on top of one another, then you open up their ability to compensate when they get to sport. Whereas if they're always living in that position, again, that roads discussion, if they're always going down the same road because they're always extended and they're always rotating an extension, eventually they're not going to be able to do that anymore. Whereas if we get them living their day-to-day lives in more of a neutral position, then when it goes time to compensate, they can do that longer, healthier, better, so on and so forth.
Yeah. Yeah, and even a sport that we didn't mention is golf too, right? Like
golf, yeah,
yeah,
100%,
gosh,
100%.
I love golf, but it's just so interesting. So it's when you look at sport from an objective lens, right?
Mm-hmm.
And you see a lot of things. Like if we were to put pictures side by side of a baseball pitcher, a tennis player, a volleyball athlete, and I might throw golf in there as well. I think what you're going to see a lot of times is either slightly off the ground or on the ground, right? And a baseball pitcher is here throwing the ball, right? A tennis player is here throwing the ball. A volleyball player is here spiking the ball. And then a individual golf athlete is out here, right, with the club head. And it's like, well, those positionings are very similar to each other. And it's just like, okay, well, dude, there's a lot here. So the relationship of the pelvis and the rib cage becomes extremely important, not just in those sports, but in all sports. And then let's put a quarterback there as well, right? I think the quarterback and a pitcher or a tennis athlete are going to be very similar as well. So it's like there's a tremendous amount of commonality amongst all of these sports that can benefit from understanding the depths of a rib cage to pelvis relationship, and then understanding the depths of like, how do I reassociate my pelvis? How can I control that in the context of training, potentially in the context of sport? I think that's a little bit more difficult, obviously, because I don't necessarily want somebody thinking about, well, what is my pelvis like right now?
Yeah.
So I don't want them focusing on their internal body right before I throw a pitch, right before a serve, or whatever the case may be.
Yeah.
You know what I'm saying? But it's just extremely fascinating when we see this, and it's just like there's a lot of stuff here, and I think we get so focused on how much did I bench?
Right, yeah. You know, one sport that I don't think gives enough credit to the relationship of the ribcage and the pelvis, I don't want to generalize here. It's basketball. They go overhead every single time down the floor.
Yep.
If you don't think that over the course of like a 10-year career and the compensations that an athlete will build up in the NBA, let alone the compensations they built up since they were 5 years old playing basketball. Right. Eventually, like shoulder flexion is going to get limited the more and more compensations that come. Right. If shoulder flexion gets limited from 1 year to the next, you bet their shooting mechanics are going to change with that. And they're going to be having to reinvent themselves, or they're going to lose their shot. They're going to lose their mechanics. Making sure that guys in the NBA who are generally like tilted forward because they're always on their toes, right? They're always being pushed forward. They're always jumping. They're always sprinting. They're always running, right?
Yep.
Their pelvises are going to drop forward. What has to happen? Their rib cage has to go back so they don't fall on their face, right? If I tilt my rib cage back, right, I'm putting my shoulder into a position of external rotation. Does that make sense?
Yep.
Like I talked about earlier, if I'm somewhere, I can't get there again, right? If I'm already somewhere, I can't go there, right? So if I tilt my rib cage back and I put my shoulders into a state of external rotation, I can't get any more external rotation, right? Because I'm already sitting there, right? And then what we also talked about, external rotation is a space and environment where we can create range of motion, where we can find space, right?
Yep.
If someone's pelvis tip forward, ribcage flared back, shoulders are set in ER, and they can't get ER, then they can't create space. They can't create space. They can't get their shoulder overhead. They can't get their shoulder overhead without compensating.
Right.
Their shot mechanics are going to go awry. And
Correct.
then you place any sport there, baseball specifically, volleyball, golf on the backswing, swimmers, right? If they can't get their arms overhead without compensating, their mechanics are going to have to change, period.
Yep. And, man, I just had a thought. Gosh, what was I just going to say? I literally just had a thought, and now it lost my mind. But I was just – I know what I was going to say. Specifically with basketball athletes, one thing that we also have to take in consideration is the length of these athletes. Like, we're not even – like, for a guy that, like myself who's, 5'9" on a good day, maybe 6 foot 5'11", right, with my shoes on –
yeah,
that's vastly different than when I'm dealing with a 6'11" athlete, when I'm dealing with a 6'10" athlete.
Yeah.
And then we start thinking, okay, well, he has a long torso. So what does that relationship look like? Or he has a short torso. What is that? You know what I'm saying? Like, it's now you're talking.
That's fascinating.
You're talking levers. It just becomes extremely interesting to account for the individualized human anatomy of all these different athletes.
Yeah, I think I've never had the privilege of working with those tall athletes, but like where my head immediately went while you were talking was give them stuff they're good at, right? So create buy-in. Like you never want to give someone like something they don't enjoy doing. So like in the weight room, I'd be jumping with them. I would be doing stuff that they like doing, explosive stuff, right?
Yep.
But at the same time, in the postural sense of like how I would train them, I think with guys that big, there are two things I would hammer. It would be constraints and references all day long, like giving them like the ability to feel all segments of their body, to feel the ground, to feel how their body moves on the ground. Because if you can move well on the ground, then you can move well kneeling. If you can move well kneeling, then you can move well standing, right? Like if you move poorly on the ground, what makes you think without the constraint of the floor and the reference of the floor, you're going to be able to move well standing
in
up.
space,
in space, right? With stimuli too. Right. And then I think in terms of like the constraints and the references, you also have to train the 180 of that. You have to take away everything, right? Like take away proprioception, do a lot of eyes closed stuff. Once they've gotten comfortable with the constraints and the references, the sooner they get to the season, and this could be any sport really, not just tall athletes, but like the amount of space they have to control, the amount of body mass they have to control, I think getting them acquainted with moving that space and doing things while you take away proprioceptive like references would be super valuable to them. That way they have a better understanding once they are in space in a game, right? So that could be like crawling variations with their eyes closed. It could be like perturbation, like Palloff press perturbations with their eyes closed or whatever, like just giving them reference to things or giving them like tasks to do in the absence of like all their senses.
Yeah. It's actually crazy you say that because there was a study done with Steph Curry. Maybe you've heard this, maybe you haven't, about him shooting. I think this was at oh gosh, I can't remember the place. Do you remember those commercials or the tidbits on ESPN about the sports science that they were doing with tackling people, and it was a
the sports science back in the day.
Yeah. Okay, so same thing. Yeah. I think it was. I believe it was with them. In almost all honesty, and you can look this up and fact check me if you want. But anyways, they did a study with Steph Curry because obviously the dude can shoot the lights out of the gym, right? Yeah. And what they did with him was because it's funny that you were talking about taking some of their proprioceptive abilities away or their senses away, is they cut the lights on him while he was shooting intentionally. And obviously, like if from shooting with the lights on to shooting in the dark, right? Like there's a large difference on that. But what they were looking at and what they concluded was like he still shot extremely well with the lights off.
Yeah.
Right?
That's awesome.
And he shot really well with the lights off. Like, everybody's kind of heard the rumor with Steph that like he doesn't count it a made basket if it hits the rim, right? Like he only counts it a made basket if it literally only hits the net,
That's crazy.
which is absolutely
I can't even make a layup. This guy's talking about not making shots
like
because they hit the rim.
yeah, literally like it's absolutely insane. But anyways, the point that I'm making is he still shot really well with the lights off, right?
Yeah.
And it was like attributed to his ability just to focus on the rim, right? And if you know basketball, like where your eyes go, the ball goes, right? And so like they just, he was shooting with the lights on, shut the lights off, kept shooting, and kept just dropping dimes. And you can go look this up too if you want to. But to what you're saying is, the perturbations with the eyes closed, the crawling with the eyes closed. I actually like to do backward skips with the eyes closed. That's one of my favorite ones because it's really funny. Athletes turn into baby giraffes really quickly. A lot of them can't even backward skip like in a good rhythm with the lights on and their eyes, looking forward. But if you close their eyes too, it's like teaching them how to walk all over again. So I love to do that because it's really interesting to see, what happens when you kind of take their, say like, hey, close your eyes, touch your toes, close your eyes, touch this, close your eyes, and they're just like, holy cow. Hey, hang there.
Give a list on that note. Like I stole this from Dakin. I was on his Instagram last year when I was in grad school, and he was having the baseball guys do skips while they were throwing tennis balls at each other and whatnot. I did that with my field hockey team as a way to make it fun, like change the warm up, have fun. I wasn't thinking anything of it. And then I saw how valuable it was in terms of like coordination, and I was like, "Oh my gosh, I would have been doing this the whole year. It's a game changer."
Yeah.
Just like because anybody can do like a monotonous skip, like maybe not a backward skip, but like after like a month of doing the same warm up, like everybody can do it 100% perfectly. They can teach it, but then you throw like another thing into it, like a stimulus such as a tennis ball or a race, or they have to do a mirror, or they have to do a chase, like we were doing at Elon, and like that's where real athleticism can fruition in the warm up, right? Why leave it to the sport coaches to give them all their athletic abilities, like in terms of like playing their sport? Why not like give it to them in the warm up, right?
Yeah. So I was very fortunate to learn from Zach, to work directly under him, as you know. And he calls those traveling skills, and dude, they're so good. And he has such an amazing system there with his 3D movement prep. And if you guys don't know about Zach Dakins and his 3D movement prep, you absolutely need to go look this up. But because it's absolutely fascinating. And with the traveling skills, he calls it engaging the brain in training, right? Because let's be honest, right? If we do the same warm up time and time again, first of all, like your athletes' output and intent in that warm up dramatically goes down. Dramatically goes down. Why? I know every single day I'm gonna come in and I have to do 5 butt kicks and then 5 high knees, and then you're just gonna start to go through the motions, and you're just gonna be like, this is dumb, right?
I'm guilty of that, man, dude. I apologize to any of my Merrimack College athletes who are listening to this right now. If you are, that I had them doing like the same warm up for like a month and sometimes 2 months at a time, and it's just like honestly, it was just laziness on my part. Like I could have definitely changed it up, but I knew they knew what they were doing. Like I could take a second, catch my breath, and I knew they would just be going in the swing of things. But like I know 100% what you're talking about. Like a few weeks in, it was just like intense, not there. Like I could have encouraged them to do more, do better, but again, like it's like it's the same monotonous thing over and over. That, and it's like like we were just talking about, the warm up is a way to like drive adaptation. Like you can get better in the warm up. It's not just a warm up, right? And I completely failed at that aspect of my programming that year. But that's what I was talking about earlier. It's like you're never going to be the best strength coach you want to be. Like 20 years from now, I'm still going to kick myself in the butt for things I did now. And so it's like, not to give myself an out or excuse, but like that's why I appreciate these conversations, because they like make me think about things I've done wrong and what I would do differently now.
Yeah, absolutely. And like I just look at it from this perspective too, like with the warm up. Okay, if you're working with, it doesn't even matter the population, but I'm going to do both. If you work with college athletes and let's say in the private sector, okay? All right, college athletes. If I work with college athletes, what do college athletes do all day prior to them seeing me? One of two things. Either they just woke up because we have training at 7 a.m. And let's be honest, how many of your college athletes are getting up, showering, getting breakfast, and, coming to training ready to go? Zero.
Yeah.
Right?
Hardly any of
them. Zero. Okay. Cool.
Yeah.
Awesome. So they're still half asleep. Great. So you should probably engage their brain. All right. Next situation. Right. You train in the afternoon. Sweet. What do they do all day? Slept in, went to class, maybe had lunch, right? Had some water, and are stressed about whatever homework, whatever relationship or friendship or whatever drama's going on. Cool. Great. Are they ready to train? Probably not, right? Okay. Next situation. You work in the private sector. They come and train early in the morning. Similar situation. How many of them are getting up, eating, drinking their water, taking their vitamins? Not many, right? Cool. They come and train with you in the afternoon. What do? Sat at their computer all day working, right? And this is the first time, maybe the first time that they've gotten any sort of movement in the entire day. Sweet. We should probably do something fun and engaging, right?
Yeah, I might push back on you a little bit there, and maybe I'm just lucky to work with people that don't necessarily fit that bill. I think because a lot of the clientele at Cressy is professional athletes, especially the time period we are now. I think they're super disciplined. Like they're paying to come here, whereas like a college student doesn't pay to go to the weight room, right? Yep. So I think they come a little more prepared in the private facility. And that's not a knock on any collegiate athletes. There's plenty of really disciplined collegiate athletes, but I think there's something to be said for someone who's forced, or quote unquote forced, to be in the weight room at whatever time of day versus someone who's paying to be at that weight room.
100%, I agree with that.
That doesn't mean we're 100% here at Cressy. Like we still have guys who will fit that bill, come, not eat, not drink, sleep. Their mind's not there, but they still paid at the beginning of the month or whatever the deal is, and so they're coming to train. And so we still deal with that, but I think if I'm being honest, it's a lot less than what I experienced in the collegiate sector.
No, so I agree with you there. And I would even say there's a lot of collegiate athletes who do a good job with this, right? So it's a large generalization, but for the mass, it's probably pretty accurate, right? I agree with you. A lot of guys in the pro world they take their craft very seriously. So if they're like, cool, I'm training at 8 a.m., they are up at 6:37 eating and doing things prior to. And I think that's fantastic. And that's also a testament to why they're at where they're at, right?
I also, and I'm going to add on to that. I envy a lot of the high school athletes we have here too. If I had an ounce of like the willingness to get better that they do now, if I was in high school, maybe I would have been an athlete in college or an athlete still to this day, like athlete playing a sport, right? I think it comes back to the fact that they're paying to be here, right? Like when I was a strength coach for my strength coach back during COVID, all the high school athletes that we were working with had to pay to be there, and I think a majority of them were there to get better. Some of them were just there to say, "Look at me, coach. I'm here at training here at Cressy." All the high school athletes. They pay to be here, and they're juiced to be in their weight room, and I love it. So
and kind of to my last point on that. So if your athletes are fitting that mold of just waking up, coming to training, haven't eaten, whatever, I would just kick them out. Like the standard that you set, like I'm dead serious when I say this. Like the standard that you set and that you allow for them to do is the limitation for them. And what I mean by that is like, okay, and I've done this, right? And I'm serious. Like I'm dead serious when I say this. Like, okay, so let's say I'm training at pick a time, 1 p.m. Okay.
Yeah.
1 p.m. It's mandatory you have 2 meals in and that you've had a half gallon of water. Mandatory.
I think these are so. I like where your head's at with this, but I'm going to push back a little bit. I think context is key. Sure. We never know what is going on. I'm talking collegiate here. We never know what is going on. Like it could be something as petty as like my field hockey athlete just broke up with her boyfriend, or my my guy for baseball, who's usually on the button, on the nose with his with his nutrition, with his sleep, everything. His grandmother just died. Right? We don't know what happens outside of the weight room, and sometimes we're lucky enough to establish a good enough relationship where they're open and trustworthy, and they communicate this stuff to us. But I wouldn't go as far ever as to like kicking someone out without context.
Sure.
I think, and even then, like even if they were just like gaming Super Mario Bro until 3 a.m, we had a 6 a.m. lift, and they didn't sleep, they didn't drink anything, I wouldn't kick them out. Like I just think, as long as like you and Andrew were talking about, as long as they don't bring an attitude that takes away from the training environment of the other athletes, then they're welcome, in my opinion, to be there. They just did themselves a disservice in terms of what they're going to get out of that workout. As soon as they start to cause tension, they interfere with another person's lift, or they just bring the overall culture of that team down, that's when I will have a conversation with them, like, get your act together, or you're for you. Right? So I think context is super important, and then a conversation with the athlete is the next best step.
So I agree with you there, and you hit the nail on the head, and I was just about to go there. You have to talk to them. Like,
right.
You have to. And what I mean by that is you have to cultivate the environment to talk to them every single day. And where I was going with that, because I agree with you, context is really key. And there's a lot of times where it's like, hey, I didn't get any sleep last night. And maybe the best thing for them to do is go sleep, right?
Yeah.
Like, cool, you didn't get any sleep last night. So, like, you're not recovered to train right now. So what's more beneficial for you right now? You can doing this lift to say that I'm a good coach and you got this lift in, or is it better for you just to go get 45 minutes of sleep?
100%.
Maybe not, right?
Yeah.
Now, does that mean that, like, I'm just kicking dudes out of the weight room left and right? Like, no. But, like, the point is the standard that we're setting, the standard that we're allowing is going to be the limitation of the athlete. And what I mean by that is if I have athletes that are consistently not eating, if I have athletes that are consistently not drinking their water, consistently not sleeping, doing the foundational basics or not doing the foundational basics, no matter how good of a program I have, they're not going to get better, right?
Right.
Like, if you're not sleeping consistently, if you're not fueling your body consistently, if you're not drinking water consistently, then, like, dude, like, I can program the best and encourage you and coach the heck out of you, but, like, you aren't meeting me halfway. And I agree with you.
Being a strength coach is we only get to see our athletes for X amount of hours a day, and they're alone more hours of the day. And so, like, we can do our job we can write the perfect program, which is not possible. We could write the perfect program. If it's not executed perfectly, then what's the point? Like, it sucks. But I guess control things you can control and do your best.
Yeah, exactly. And, like, I agree with you. Like, if I have a dude that is, like, consistently on and then one day he's just off, I'm not like, dude, get out of my weight room, like, right now. Like, no, I'm like, hey, what's good? Like, talk to me. And then I'm like, cool, I got you. Like, if you kind of don't want to train hard today or whatever the case may be, like, I got you. But what I won't allow is the consistency of, like, oh, coach, I'm just not going to do this. I'm just, you know what I'm saying? It's just like, okay, well, like, we need to really have a conversation then.
For sure.
And so I agree with you. Context is really important on that. But I think the standard of that is, like, you have to come at it from the perspective of, like, I want you to win. So if Dan is my athlete, damn, I want you to win. I want you to be the best athlete possible. So, like, you need to be consuming food, right? And, we can talk to the dietitian about what you need to be consuming, blah, blah, whatever. You need to be X, Y, and Z. You need to be sleeping. You need to be doing all this stuff. Like, if you don't sleep that day, like, let me know. I need to know that information, because what if we have a sprint session for that day and we're testing, whatever the case may be, like, it's going to show up, but I can make a note on that to be like, Dan slept 4 hours yesterday.
Yeah.
Is this an indicator of why his performance was low? Potentially. Like, I can just get more information, more context from you to then be like, okay, cool. Like, hey, what's going on? Like, what's up? Like, if, whatever the case may be. And the goal is that you develop a relationship with your athletes where, like, I may not have to go seek Dan out for that information. He's just going to come and tell me that information.
Yeah. Yeah. And I think like a lot of our job as strength and conditioning coach is to write good programs, right? But I think
Yeah.
it's even more important to build good relationships, honestly.
100%.
You're like, you could be the best strength coach in the world, but if you suck at communicating, and I learned this lesson the hard way.
Sure.
That's how I know this lesson.
Yeah.
If you suck at communicating, if you're not good at like towing the line of being a friend and a coach with the athlete to gain their trust and whatnot, and if you're not willing to have like open and honest conversations with the athlete about like what they're doing well, what they're not doing well, asking them for feedback, then they're never going to come to you with those problems. Unfortunately, I've only had 1 year in the collegiate sector. In the private setting, it's a little different again, I think, because they're paying and they want you to know things that are going on. Maybe. I don't know.
Well, that, and I think you have a little bit more time. And what I mean by that is,
we do. Like, oh my gosh, yeah.
Yeah, like
I have so much more face time. Like I have these conversations every day with athletes for hours at a time. Whereas in the collegiate sector, it's an hour with 30 different people. I'm not asking, no, like I wish I did, but I'm not asking like, oh, dude, how's your brother? You were telling me about his job interview last week. Like that, those conversations never came up. Whereas like I would have that conversation tomorrow with an athlete. And so like that trust is built faster, easier, all the above in terms of, but then again, like if I was a college strength coach for 4 years at the same university and not just the 1 year at Merrimack College, maybe by the fourth year or the third year, even the second year with my freshman swimmers or my freshman baseball athletes, I start having a lot more of those conversations. But I don't know. I'm curious to get your opinion, curious to get the opinions of other coaches who have been at the same university for X amount of years and their seniors are like best friends with them at that point.
Yeah, exactly. And I think, and just to kind of start to wrap this up here a little bit, for me personally, a lot of my conversations with them are, they are, yes, I'm going to coach you hard, but I also want to get to know you, right? And I want to know about your family. I want to know about how mom and dad are doing. I want to know about brothers and sisters. Like, heck, I mean, even with my athletes at West Point, like they introduced me to their parents. Like, hey, this is coach. And I'm like, hey, what's up? Like, and then I'll see them at games and I'll say hi, or like they'll introduce me to their girlfriends or whatever, right? And it's just like, cool. Like now I'm becoming a part of that, right? Rather than just like not knowing about it. So then it's just a matter of like, I'll dab them up. I kind of have 3 H's that I go by every day: handshakes, hugs, and high fives. That's kind of like my thing that I do with my athletes every day. And, so I'll give them a handshake, I'll give them a hug, or, whatever the case may be, or a high five, like kind of whenever, right? Dab them up, whatever the case may be. But then it's just natural conversation. Like if I were to see you, Dan, like, how are your parents doing? How's, you know what I'm saying? And it's more of a professional, like get treated like professionals rather than like, don't ever talk to me. Like, and I'm like, nah, dog, like I want to know about that. Like, what's good? Like, heck, I had athletes be like, what should I get my girlfriend for Christmas? And I'm just like, all right, well, like, I don't know about that. But, it's just like the development of the relationship, like you said. And so it ebbs and flows so much from like, I'm your coach right now, and we're talking about getting better at training to like our session's over. Like, hey, man, what's good? Like, how's life? You know? So,
I think in my time, my 2-3 years as strength coach, I think the thing I'm most grateful for are all the relationships with the athletes,
100%,
with my mentors, with people I've interned with, my peers, right? Because I hate to bring quotes into this, but Ralph Waldo Emerson said, "Every man I meet is superior to me in some way, in that I may learn from him." I've learned something from every single person I've come in contact with, whether it was like something I don't want to do ever again or something that like I want to do a lot more of. It's just like having the relationship, having the networks has been so rewarding for me that like I don't really care how much I know in terms of X's and O's and S and C. I think I care more about like making sure that the relationships that I've built so far stay strong, and the ones that I like messed up because I was a not such a good person in my younger days, that I mend those fences, because I think people are what matter.
Yeah, 100%. And it's the classic saying of like, nobody cares how much you know until they know how much you care. Right?
100%.
And like,
100%.
And last thing here, but like my athletes don't care if I'm running a triphasic daily undulating periodization mod. They don't care about that. Like,
nor
they
do
don't even
they
know what that
know
is.
what that means. So yeah,
Exactly.
like you could be running. I don't know if how much do you believe in this, right? You could write the worst program ever,
Mm-hmm.
right? One of the worst programs ever.
Mm-hmm.
As long as you don't hurt the athlete, right?
Mm-hmm.
I'll give that one caveat in terms of the worst program. You don't hurt
Mm-hmm.
the athlete. I feel like the placebo effect is such a big thing that if they trust you, if they love you, if they buy into you,
Mm-hmm.
a lot of them are still going to get better from it, as long as
Yep.
again they don't get hurt.
Yeah.
I don't know how true that is because hopefully I've never been in that situation where I wrote a really bad program
Yep.
or have seen one.
Mm-hmm.
But I just think that the power of relationships are way more important than
Yep.
the X's and O's ever will be.
Yeah, 100%. The power of belief too. Like,
Yeah,
you know, it's the saying of like, you can have a great program and a bad coach, or you could have a great coach and a bad program, right? Like, the great
Which
coach
one
is
you
going to
take?
make, that great coach is going to make that bad program really good, right?
100%. Yeah,
Whether that's their, and I think a big thing is energy. I think a big thing is energy. I mean, you know that we've coached together, but I think the biggest thing for coaches is energy. Like, be juiced up. And I don't mean yelling and screaming your face off. I think that's just all fake BS. But like, get juiced up, get excited, be intentional, like, love what you do. Like, I hate the just yelling just to yell. Gosh, I think that's so dumb.
Yeah,
Like,
and I've struggled with that too, man. Like, again, I'm not perfect. I love what we do. But where I think I really failed in the collegiate sector, especially, was every team has their own identity, every team has their own culture, and your job, kind of as the strength coach, is to mirror that during that specific coaching session. So, like, I would get juiced up for baseball, not only because I was passionate about baseball, because that was like their term. They would break the huddle, 3, 2, 1, juice. Like, that's what they would say, literally. And then field hockey would come in or swimming come in. Two different personalities, and I tried my best to match them, but at the same time, I think it's like, don't ever be someone you're not. I was never the guy who was going to be running around like yelling and like hyping athletes up just to hype athletes. Like, I hate to say it, but it's not me. Like, I'll hype athletes up here and there if like I'm like super juiced up about it too. But like, great set, let's go. Like, that's just not me. Like, I can't do that. But that's sometimes what they need, and so I struggled there, like getting out of my own comfort zone to being what the athlete needed or what the team needed, and I struggled there for sure. I think it's like anything. If the more you practice it, the more reps you get with it, the better you get it. And that's where I struggle.
I actually think you need to be the opposite of the team, and here's what I mean by that. All right, so let's say your guys come in super juiced up, right? Like, let's say it's
you need to be the guy that humbles them. I get it.
Yeah. Let's say it's on Farm Friday, baby. Like, we're getting after it. Like, they're juiced, they're ready to rock. You being juiced up isn't adding to that. You know what you need to be in that session? A technician. You know what I'm saying? Like, so when they're super juiced, I'm quiet. When they're quiet, I'm juiced. And so it's just like being like the opposite of that. Because like, think of it this way. If they're super juiced up, like, I can compliment that and that's great, but am I being an effective coach at that moment then? Right? But
I like with that.
If they're super juiced up and they're getting after with the intent and the effort is there, and I'm like, yo, you need to go down 2 more inches, or I'm like, don't forget, we need to be intentional on this. They're gonna be like, heck yeah, like, they're just gonna buy into that because you're like, let me redirect you here, stay juiced up, but because you're so juiced, I need you to think about this, and vice versa. If it's just like we're sluggish, we've been on the road, we didn't get much sleep, whatever the case may be, I'm going to be the guy that, one of two things. I'm going to be the guy that's like, hey, let's go, let's get excited, right? Because they just needed that motivation to get through. Or I'm going to be like, hey, today's a recovery day, and I'm going to give them 2 things to focus on. I want to make sure we get this done and that done today. Cool? Can we do that? All right, that's good. And then just go from there, right? Because it's like, if they're super down, right? Like, hey, give me these 2 things. That's it. That's all I want. That's it. Done. We're good? Cool. Awesome. And go. And I found that to be successful, and that's worked really well personally.
Yeah. 100% agree.
So, well, Dan, I want to respect your time. I want to respect everybody else's time. So this was really good, man. I learned a lot. I got to dive more into PRI and some other things and see how I can help my athletes as well, because I'm not very educated on that component of things. But man, I just want to say I appreciate you. Where can they find you at? Dan has a blog. Where can they find you at? Where's the best place to reach you at?
My normal Instagram, my just day to day is Dan Rosen _, and then I have another account that I just kind of post my thoughts on. That way I can go to bed and not be thinking of them. Yeah. It's DR Human Performance. Yeah. I get a lot of crap for that at the gym. People call me the doctor of human performance, but it's just my initials, people. So yeah, those two places people can find me. And, I love talking about this stuff. So feel free to reach out and ask questions. Let me ask you questions, and let's share the knowledge.
Yeah, absolutely, man. And so guys, if reach out to Dan if you have questions, specifically PRI. If you have questions, I'm sure you have a lot of questions after this episode, like I do.
So do I.
I think we could spend another 4 hours talking about it and the intricacies and stuff. So, but brother, I just want to say thank you very much. I appreciate you. Appreciate your time. Appreciate what you're doing at Cressy Sport Performance. I'm glad that you're there and that you're loving it. And guys, if you like this episode, if you learned something from it, if you're watching on YouTube, drop a comment or drop a question in the comments, excuse me. And if you're on Spotify, Apple, or any other podcast platform that you're just listening, do us a huge favor, like this episode and subscribe to it. Let Dan know what a great job he did. And guys, reach out if you have questions, because I'm sure you'll have a lot of questions after this one. So that's all we have for today. Thanks, Dan. Love you, man. And we'll chat here real soon.
Love you, dude. Thank you for having me.
Yes, sir.